let's talk a little bit about like implementing these LEAD guidelines, like in a clinic, if you're in a wound clinic or maybe a vascular practice or a WOC type of clinic. What kind of things would you recommend to somebody who's like listening to us and thinking, I need these guidelines in my clinic? What do you think about that, Dr. B?
Well, I think first of all, what I would say is don't try to do it all at one time and don't try to do it alone. Implementing changes in practice is time consuming, it's complicated. There are a lot of factors. It's not going to be, quick and simple. It's going to require a team effort. And so we've recognized that there are problems with implementation about getting the guideline into point of care.
Right.
So that it's actually impacting. And there are a lot of reasons for that. We have a quick brief guide that we put into the guidelines since, I think it was since the 2018 or 19, when we started doing them, that was based on the applying evidence to practice from the knowledge to action framework, where you've developed the information. Now, how do you get it implemented into practice? So we have some information about that in each of our guidelines now. But it's very important to plan and prepare the right team to be successful. You want to look at some of the gaps between practice and the recommendation, maybe kind of review them and see what might be important and prioritize them. Establish a plan, get a group together that can help. I think the WOC nurse is always the champion and the cheerleader, and very often feel like they have to be the team leader. And certainly we are the linkage agent between the development and then getting them at that point in care very often for wound care.